Hello, I'm Dr. Gary Gordon, and I'm here to tell you how to not die of a blood clot. In our world today, experts feel that between 50 and 90% of all heart attacks are blood clots. At least 70% of all strokes are blood clots. So we have a huge industry in America today giving you drugs to thin your blood or avoid blood clots. And a lot of people have been told aspirin was going to help them a lot, but the facts are that the genetics don't work and at least 30% get no benefit. And although there's an antiplatelet effect, there's no anticoagulant effect, so it is a very, very small benefit. Then people move into taking Plavix or Coumadin. When you read up on Coumadin and go to my website and put in the word Coumadin when you search, you will find that I'm rather strongly opposed to the use of Coumadin, or even Plavix for that matter, for anything but short term. So the problem is that I have practiced medicine now for over 50 years. I'm 74, and my heart problem developed at age 29. So do I want a toxic drug starting at age 29 when I plan to live to at least 100? Do I want to be supporting that toxic drug when we know that Coumadin, proven, increases the level of calcium in your arteries, making your arteries harder so they don't have any flexibility? And if you have hardening of arteries, you're going to have what? High blood pressure. And if you have that, you're going to have earlier death. So I am a very strong advocate of teaching you how to have strong bones even when you are 90 and soft arteries. Part of my doing that is done with vitamin K2 and a product we call Beyond Bone. But what is exciting about Boluoke is that the Chinese found years ago that the earthworm made an enzyme that we call lumbrokinase. This enzyme actually works in a manner very similar to an American drug called tissue plasminogen activator, TPA. The problem with TPA is it's only given to you after you've had a stroke or a heart attack, and the injection costs between $3,000 or $6,000. If you weigh over 90 pounds, you'll be paying $6,000. And so that's closing the door after the horse has been stolen. So we're amazed to be able to tell you that we have seen reports of people able to take lumbrokinase, known as Boluoke, and take this capsule and miraculously see the clot open up even 3 and 4 days after the patient goes in the hospital with a stroke and part of the body doesn't work. So I am very confident in what I'm telling you. This is as powerful as anything needs to be, and yet totally safe. If you're on Coumadin, if you read up on it, it's about the most dangerous drug we use. We have people going in the hospital all the time, world famous people, heads of state, go in the hospital with a massive bleed and they become comatose because of the side effect that they couldn't get the right dose with the Coumadin. Getting the right dose with Coumadin actually requires doing some genetic testing, which most doctors ignore. But since Coumadin will turn your arteries into stone and make them hard, I teach everybody that part of my whole game is to keep you alive. And I haven't had a patient call any emergency room with a fatal heart attack. There's been none in over 20 years. How did I do it? I found natural ways. You can thin the blood safely. Everything from omega-3 to the use of what I call my oral chelator, essential daily defense. But because we have such a complicated, poisoned world today, this simple package, which is the easiest way that I've kept people alive. If somebody calls me and says that they've been told they have to have bypass next week, and I tell them there's a risk that the bypass might permanently harm them or even kill them, I tell them, I haven't had anybody die that I'm aware of with a heart attack in over 20 years. I have people buying the Beyond Chelation. But the Beyond Chelation, as good as it is not quite enough for somebody who's already having a lot of symptoms, or if you have a history that you've already had a blood clot, or everybody in your family dies of sudden death. So be aware. If you don't do more than keep a bottle in the house for a friend, This is real medicine, but it's all natural. And you can help people even after they've had a clot, heart attack, or stroke. Thank you for your attention. Boluoke and lumbrokinase with Beyond Chelation Improved, the packet taken twice a day, this taken twice a day, is my basic approach to canceling all stenting, all invasive cardiological procedures for blocked arteries, all bypass. I simply tell my patients that since I haven't lost anybody in over 20 years, if you were to die while on this program, the Creator must have had a very important need for you, because you'll be the first one to have died while on this. Thank you for your attention.